Hello, and welcome to Healthwatch. I'm your host, Carolyn Wilson from Ledgelight Health District. The goal of this program is to bring you information on a wide range of interesting and important health topics, and to introduce you to the great people doing important work across the community. Today, I'm joined by Cheryl Haase, Environmental Technician 2 at Ledgelight Health District. Today, we're going to be talking about lead poisoning prevention. Cheryl, welcome to the show.
Hey, Carolyn, thanks for having me.
All right, so let's get started by giving our viewers an opportunity to get to know you a little bit better. Tell us how you got involved in the public health field.
So probably in the mid-90s, I started working for a local municipality, working for a building and health department. At that time, I found the health stuff very interesting. So I went to Southern and started attending the environmental health public program and working on my certifications. And from there, I sort of went forward. And actually, this coming April will be 5 years at Ledgelight. So it's kind of fun. It's got a lot of different elements to it in the public health sector.
That's great. So what does a typical day look like for you at Ledgelight? What keeps you busy?
So right now is a typical day. I mostly do land use activities. So as we head into the spring and the summer, things are going to get extremely busy for us. We do a lot of soil testing and septic inspections. And the other thing that's really busy for us right now, which we're going to talk a little bit more about, is lead. Some of the legislation has changed, so we're doing a lot of environmental inspections as well as educational background talks with families and physicians and things like that. So this time of year can be busy. Some of the other things that we tend to do in a typical day are complaint inspections, as well as we move forward, we're going to be starting to inspect public pools and salons and things like that. So a big diverse of things that we also do here at Ledgelight in the environmental health program.
Great, never a dull moment. Let's talk about lead. Some of our viewers might be aware that local laws have changed recently having to do with lead, especially screening levels for children. Tell us about those changes.
So there were two major changes in the legislation. One was in 2022 and the other was in 2023. The one that happened in 2022 took the reporting requirement for physicians and laboratories from a 5 milligram per decimal down to a 3.5, whether that is a finger stick or an actual venous draw of a child. And then the second requirement that happened in 2023 changed and is significantly, over the next couple of years, has reduced the levels for when the health department interacts with the family, whether that is talking to them on the phone or actually going out to conduct inspections at their property to determine what those lead level risks may be. The big thing in those changes was that all children between the ages of 9 and 35 months must be tested annually for the lead levels in their blood. So those are kind of the major big changes that happened in the last couple of years.
Right, keeps everybody really busy. So what services does Ledgelight provide for lead poisoning prevention?
So one of the big things that we're working on right now that we've sort of put a campaign out for is actually meeting directly with the physicians and discussing some of these new law requirements and the reporting factors. And as well as, understanding that Ledgelight is here. We are a great resource for parents to have us educate them. As of January 1st, the levels for children for when we go into their homes and do an on-site inspection is between a level of a 5 and a 9.9. So a lot of those are the services that we'll do. By law, we get a copy of everyone's records for what their levels are. So we have a reporting system where we will contact them and get them the information that they need and set up the different services. Depending on the different levels of the children, That is where we determine the type of service they may need, whether it's just a visual inspection or if we actually conduct a full on-site inspection, which could include things as doing the water, the soil, and actually doing an XRF. This is actually an XRF device. I don't know if you can see it. It's a little device that we use when we go into properties to conduct inspections, and it actually will go right down to the substrate of the different materials in a home, and we can know whether or not lead exists within that home.
Wow, that's great. Thank you for showing us that. That's a very interesting piece of equipment.
It's one of our toys that we have here, and it's a very helpful toy.
Great. So it's fair to say that we've been doing a lot more with lead, given that we've had these new this new legislation.
Correct. I think they're estimating that over the last couple of years, where our caseload was 1, that has increased probably from 10 to 15, probably a little bit higher in the New London area and the Groton area, where we have housing stock that is higher for pre-1978. So that is a huge caseload. We're definitely able, we have multiple staff here who are lead certified. And so we are all very busy out there talking to people and doing inspections for them.
Thanks for that great information, Cheryl. It's time for a quick break. We will be right back with more Healthwatch.
When I was growing up, my mom was extremely tidy. We were trained to put things back where we got them from. One day, when I walked into my mom's house, I felt like I walked to someone else's house. There was stuff everywhere. And just growing up the way I grew up, and to see this transition was very alarming.
When Sean talked to me, it was a wake-up call, and that's when I went to the doctor.
Welcome back to Healthwatch. Today I'm joined by Cheryl Haase, environmental technician at Ledge Light Health District, and today we're talking about lead poisoning. So before the break, Cheryl, we were talking a little bit about your position and some of the changes in legislation for lead poisoning. Let's talk a little bit more about risk factors. Tell us, what are some of the risk factors for lead poisoning?
So there are definitely several risk factors that can contribute to lead poisoning. I think understanding those and identifying them, especially our communities that are in higher risk. We know that the age, so generally, or I shouldn't say generally, but we monitor children under the age of 6. So age is very important because our young children are at highest risk, and that is mostly because they are more likely to put objects in their mouth. When they're napping at night or sleeping, their way of soothing themselves is to put their hands in their mouth. So it's basically, hand to mouth contact. They're the most vulnerable, and those effects are very harmful from the lead to children. Some of the other factors that we look at, especially in neighborhoods that are pre-1978, we have a lot of older homes. For parents and contractors to understand those risks when they're doing repairs within their home, when they're renovating, it's very important for them to understand that when they do that, they're disturbing that lead paint. Once you disturb something, that's where the hazard is created. The lead dust is so fine that most people actually don't even realize that they have disturbed the lead dust. So one of the things that we try to do is really educate people about how they've created that lead dust and how properly to maintain that within their home, and to really understand that exposure that's happening within their home as they're working on home projects. People can work on their homes and they can do them very safely. It's about education. That is key. The primary source, obviously, that we know, it's within our homes. Lead paint was not banned, and even all those pre-1978 houses, even into the early 80s, we do sometimes see homes that still have lead paint in them. So again, that's what we want to know. Some of the other things that we've seen around here within our district is the occupational exposure. Well, our regulation does not really look at the adult exposure. We know that adult lead exposure does happen, and that happens more under the workplace standards under OSHA to understand those hazards. So that's sort of monitored outside of what Ledgelight does. But understanding battery manufacturing, certain types of plumbing, those are things that are also of high risk to people, those occupations. Even gun ranges. Gun ranges have a lot of exposure. We have had cases. We do have a couple gun ranges that are in our health district that we have seen things that have come back. Those levels are very high on a shooter's hands, as well as their clothing. And again, so that's education and teaching them when you go home, take your clothing off, make sure you're washing and showering correctly before you're picking up those young children. The big thing that most people always talk about is, because it was so it was so much in the news, was Flint, Michigan and the water. So we look at the programs. In our program, we look to whether or not we may want to test the water. There are certain things that will require us at different levels for a child. It's also important to understand, I know the City of New London has a very active project that they're working on to help replace some of those lead lines. I always tell people, your drinking water is safe, it is tested, but it's important to understand that the plumbing within your home is often where that risk may happen. So we talk a lot to parents about flushing water, using cold water and flushing it for making baby formula, those kinds of things. We have a lot of cultures that are within our community. Some of those cultures, unfortunately, bring back pottery. Some of these potteries are traditional. They like to cook in them. Some of those glazes that are on a lot of those potteries actually have very, very high content for lead. I recently did have a family, grandma from Mexico sent over this beautiful pot that she was cooking in. We realized what those levels were. We eliminated that source and the child's levels went down. The other thing that we look at in some cultures are the cosmetics that they may use. Those makeups sometimes contain exceptionally high lead levels in them. Again, I think we talked a little bit about hobbies. So a lot of things that people who are still doing stained glass and soldering, that's very, very high in lead. And one of the other things that we sometimes will look at is soil contamination. What we look at is around the drip line of a house and or play areas where children may be. We don't always, depending on where we are, and again, what levels with a level a child may be, we may or may not take soil samples. And so we want to be clear, we don't want our children playing in contaminated soils. We'll work with families if we think there's a contamination of soil and how to, deter children. Plantings, grass, a walkway, things like that. How to abate those things. Obviously, painters are at very high risk. Those are the occupations of parents. Trying to teach parents to, I know we all want to come home and hug our little babies, but to really try to come up with a different entrance for your home where you're removing your clothes, you're removing your shoes. So those are a lot of key things. I think it's just important for people to be aware of what their risk is in their daily life and how to prevent that when they come home.
Absolutely, and that takes us to our next question, a little bit more about prevention. Given all the things we just talked about, the several different risk factors for not only kids but for adults, what would you say some of the top prevention tips are for how people can prevent lead poisoning?
So I think your best steps in preventing lead exposure is understanding that. So inspect your home. Assume that if your house was built before 1978, that it probably has lead in it. Look for chipping and peeling paint. Old windows, what we try to look at when we do inspections are friction surfaces. Those are your windows and your doors. Some of these houses have some beautiful old trim to them. They're gorgeous. We want people to save that. We want the beauty of these old homes, but we also want people to understand that, you can go to a hardware store or Lowe's, and there's at most paint stores, they'll have a little swab test, and it's got a chemical in it. And as you apply it to the surface, it will turn red. If it turns red, that means that it's positive for lead. Those are good little measures for yourself to put into place before you start a project, so that you know if it is positive for lead. And even I tell people, even if it does not, that's just testing the initial surface. It's not going all the way down. Some of these older houses have multiple layers of paint on them. Understand that when you get down to that 5th or 6th layer of paint, that may be lead. So again, always work safely, try to work professionally. If you're hiring contractors in your home and it's pre-1978, the federal law requires that they be certified and that they work safely within your home. We can talk about that a little bit later. But, and the other thing is understanding how to properly clean your home. We're not here to tell you you're cleaning wrong. We're just trying to educate you that when you're cleaning, dusting and sweeping, those are the things that are just putting the lead dust airborne and ultimately coming back down to the surface. So we try to teach people to really wet clean. By that, I mean using like a damp cloth, wiping in one direction, folding it over, and trying not to smear the lead dust from one surface to another. Really working with a cloth, folding it over, changing, cleaning. And then the other thing, which is expensive, is HEPA vacuums. But for carpets, obviously, try to really, if you are somebody who has a house that is under construction or renovating, sometimes you can rent a HEPA vacuum. Very efficient, highly recommend it that you do that. If you have a contractor in your house that's doing that, they 130% should be using a HEPA vacuum. Not even a question, they should be. Again, promoting health, hygiene, promoting hand washing, washing toys, encouraging your children to not put things in their mouth. That's hard with little kids, but we try our best. And even before they go down for a nap, wash their hands. It seems silly, but if you get into the routine, it will become an easy thing to do. Before you give them a snack, wash your hands, wash your hands. Soap and water. It's very important. Not only for lead, but probably just general health practice. And then the other thing that's key for a child with lead levels is diet. Diet is very, very important. We want to make sure that our children are getting the right amount of calcium and iron, as well as their vitamin C. Sometimes what happens with children when they have certain lead levels, their diet sort of goes away and their body doesn't think that they need these things. So it's important to really make sure they're getting all the essential, we all know the little food plate where it has all your dietary needs on. Those are very key to make sure your children are consuming those things, especially the calcium and the iron. Again, as I mentioned, running your water. If you're in an older home, just run your water for a couple of minutes before you use it. If you're making formula, make sure you're using cold water. Any of those imported goods that you may have in your house, be cautious of them. And medical checkups. I mean, that is ultimately your biggest thing. And it's sad that the only way to measure the exposure of lead is that we have to use our children. No level in a child is safe. And so it's important for you as the parent, it's important for the physicians to do those required medical checkups. And I use the word required because you are required to be screened. It's very important. We don't want children with lead levels. The exposure over time has shown to be harmful to children. And so again, we just want to educate people. We want them to consult with us if they have any questions. There is plenty of information out there. I try to encourage people to stay to the local websites, stay to the government web pages, the CDC, the EPA, the health department, both the state has really great lead resources, both for homeowners, contractors, physicians. It's very nicely broken down for them.
Great. Well, we've covered so much. Just really basically, what is the major concern about lead poisoning in kids, like health-wise?
So we know that over time there's neurological damage. There could be cognitive developments. We've seen an increase in different learning disabilities and behavior problems within children. We also know as those risks, as those levels become higher, that there are, it can affect fertility as you become older and you start to want to plan to have your own children. Developmental issues, even for exposure for moms who may be pregnant, and that risk to the fetus itself. But I think the main thing is those neurological, and we also know that those damages sometimes it's permanent. It's irreversible, that damage. There have been studies that have shown that while we may not see it when they're really young, we do as they proceed into their 20s. That's when we start to see what some of those damages may be to them.
Right. And lastly, you mentioned how important it is for parents and caretakers to have their children screened. What age do they need to do that?
So the testing generally occurs around, most times pediatricians will do it at their 1-year checkup. The other thing is maybe when they go in at the 9-month checkup. But between 9 and 35 months is where that checkup will occur, that initial checkup. If then part of that is depending on where a child's level is. So if a child is less than a 3.5, that's great. That means that we don't require a follow-up. While we would like to measure to 0, the problem is that a lot of the screening devices that test for lead can't go below a 3.5. So that's sort of the number where they came up with. Once a child goes from a 3.5 to a 9.9, our office will actually send out educational packets to the homeowner with a reminder letter that says to have your that you need to have your child taken again in 3 months and follow up with your pediatrician, have that done again. Part of that gets a whole educational packet about the exposures, all the things we've talked about the diet. And then obviously that they can call us. We want people to call us. Right now, the law does require that when a child is between a 3.5 and a 9.9, that we do a in-home risk assessment. That could mean anything from just doing a visual inspection, finding that there's really nothing wrong. Maybe the exposure is actually happening at grandma's house. Maybe the exposure is happening at somebody who's a care provider during the day. So we'll look at those kinds of things. Sometimes we may actually do dust wipes within the house to determine what that risk is. And then we'll talk about how to eliminate some of those exposures. Sometimes that's us talking to the landlord. The landlords have a duty to maintain their properties. And I encourage tenants to talk to their landlords if the house is not in good condition. They have a responsibility to maintain their properties.
Great.
So we do want to encourage that.
Perfect. Thank you so much, Cheryl. You've provided so much important information. Thank you for reminding folks where they can go to get more information if they want it. And thank you so much for your time today.
I appreciate it. We want to prevent, and as I said, no level is safe in children. And we want to help reduce those levels. And however best we can do that, we're here to support the community.
Great. Thank you so much for tuning into Healthwatch today. We hope you'll join us again right here on Healthwatch.